If you are a new parent or about to become one, you must watch this video till the end. What if I told you that many of the skin changes that you'll see in your baby's first few days or weeks are completely normal, harmless, and will go away on their own? Hi, I am Dr. Neldy Gonsalves, and today I am going to walk you through the most common newborn skin findings every parent should know about, so that you don't panic and know exactly what warrants a medical consult. Your newborn skin is actually adapting from life in the womb to the outside world. It is physiologically immature. So let's talk about a few skin conditions that we encounter very commonly in our day-to-day practice. The first being Erythema toxicum neonatal, also known as newborn rash. Don't be scared because it has the word toxicum in it. This rash looks like a red rash with yellow or white tiny bumps which occur on the trunk, arms or legs. It occurs within the first few days of life and it peaks around day 2 or day 3. It may last for 1 or 2 weeks. This is a harmless rash and it goes away on its own and does not require any treatment. The second condition I'm going to talk to you about is Milia. These are tiny white bumps that are seen on the nose, on the cheeks or the chin. Now this is caused when the skin debris is trapped in tiny skin sacs. These last for 3 to 4 weeks. Again, it does not require any treatment. Parents, don't try to squeeze this milia out. The next condition is transient neonatal pustular melanosis. These appear as tiny pustules at birth that rupture and leave behind brownish spots. These are completely benign and self-resolving. The other condition is what we call infantile seborrheic dermatitis. These are greasy, yellow-white scales which are seen as crusts on the scalp and sometimes even on the baby's eyebrows. It doesn't itch usually. The treatment is using a gentle shampoo and a soft brush to take those flakes out. This is also a common condition and shouldn't be mistaken as a sign of poor hygiene. The other condition is Mongolian spots. This is dermal melanocytosis. Now this appears as slate grey or blue flat marks which are seen usually on the back or buttocks. These usually take a few years to fade. I'm sure you recognize this. We call this salmon patches or stork bites or angel kisses. These appear as pink or red patches on the neck, eyelids, forehead or even on the nape of the neck. Now these can look darker when your baby cries. The other thing is harlequin color change. Now sometimes half of the baby's body may look more red for a minute or two when they lie on one side. This happens because there's a temporary vascular change due to immature circulation. So you don't have to panic at all because it goes away very quickly. I know we all hear about teenage acne, adult acne, but did you know even babies can get something called as neonatal acne? These are red pimples or whiteheads which appear on the face, usually on the nose, the cheeks, the forehead. They often resolve in a few weeks to months. This is probably the most important part of the video. When should you seek medical advice? Although most of these findings are harmless, don't delay seeking help if you see that the child has fever, lethargy, irritability, if the redness is spreading, if there's any foul smell coming from the rash, if it's a very painful skin condition or you see blistering, if the lesions are on the palms and soles. Also, if your child has a rapidly expanding birthmark or swelling near the eyes or the nose or the mouth. These are not benign skin conditions and may need urgent treatment. Remember, newborn changes almost always look scarier than they are. Parents, never hesitate to ask questions to your dermatologist. Don't worry, you are all learning and we are always there to help. If you have any doubts regarding any of these conditions, leave a comment and I'll get back to you. Bye. See you in the next one.